Hi everyone, I'm Dr. Rita Roy, CEO of the National Spine Health Foundation. I'm here in New York City at the International Spinal Deformity Symposium. I'm joined on the panel today by some of the directors of this program. At the National Spine Health Foundation, our mission is to educate the public about spinal health care. Our premier educational platform is Spine Talks. Today's Spine Talks brings you unparalleled access to these world-class experts from our medical and scientific board who represent the top 50 surgeons in America.
We're so excited to be here in New York and learning from these incredible experts. I'd like to introduce you to our panel. First, we have the chairman of the course, Dr. Larry Lenke, past president of the Scoliosis Research Society and one of the professors at Columbia University and surgeon-in-chief. We have Dr. Serena Hu from Stanford. She is the chief of the spine surgery section of Stanford, and she's also an incoming president of the Scoliosis Research Society and current president of the American Orthopedic Association. And Dr. Ronald Lehman is a professor at Columbia also, and he is chief of spine surgery. I request the three of you to just give a little pearl of advice about spinal health, spinal deformity, spinal anything to the public.
Yeah, for spinal health, basically, we have to stay in shape. We have to have good nutrition, good watch our weight, have good bone health, watch for osteoporosis, trying to prevent osteoporosis if we can, and live a healthy lifestyle. Obviously, that'll give you the best chance of having a good spine. If you're unfortunately, if you have some type of abnormal spinal curvature or true postural malalignment that turns into a disabling deformity, then bottom line, and there is hope. If you basically do your research, find people who know how to take care of you, and if you need surgery, find out if you need surgery, if you don't. But if you do need surgery, the good thing is that the results are so much better now than even 10 years ago. Will only get better in the future. So the future is bright for patients who are afflicted with spinal deformities.
Excellent. Serena?
No, I think you summarized it beautifully. We've made a lot of progress. We know how to help you get better so that you can either avoid surgery or be better prepared for surgery. Hopefully you don't need it. But if you do, I think we've gotten a lot safer at doing it and hopefully restoring people to normal lives.
Yeah, maybe the only other thing to mention is, in addition to what Dr. Lenke said, is that we also realize a lot of this stuff is genetic. And so if you have a brother or sister or mother or father or a grandparent who has scoliosis or kyphosis or the spondylolisthesis and slippage or stenosis, which is the pinching of the nerves either in the neck or the low back, you're more apt to potentially have it in your family. And so understand that earlier, get screened when you're in elementary school for spinal deformities and curvatures and things like that, but also know this may be coming down the road, and so understand it earlier, maybe get seen a little bit earlier, and then you can help educate yourself and maybe do some of these rehabilitation things before it becomes a problem.
This has been fantastic. I think we're so lucky and so honored to have your time today, to have your input, your honest feedback, your honest information for patients. We try so hard at the foundation to take the brilliance that's coming out of the scientists and the medical professionals and translate that into information that people can use to make the best treatment decisions for themselves. We've talked a lot about the word alignment today, and in the foundation we have an infographic that says curves that align make up your spine. And so come to the website and take a look at that. So it sort of rhymes and top fives and lists of things, and how can we distill very complicated information, make it consumable and easier to understand so that you can make the best decision for yourself along with your doctor. And we cannot do that without the brilliance of healthcare heroes who are taking the best of medical science and putting that into practice every day. And so we are so thankful to you for doing this for us today. So thank you very much.
Thank you.
Thank you.
Thank you.